Hi, my name is Adriana Rosales, and I'm a student physical therapist assistant from CBD College. My first patient is a 42-year-old who presents with a right glenohumeral slap lesion. She is currently in the acute phase of healing due to her being 5 days post-op surgery repair, and is currently experiencing a 5 out of 10 pain with walking and a 2 out of 10 pain with rest. In this phase of treatment, our main goals are to decrease any inflammation, monitor pain that she has, protect the healing tissue, and overall just maintain the range of motion that she has. 3 exercises that I would be doing with her would be passive range of motion or active assisted range of motion, assisted shoulder flexion, which would only be to 40 degrees since that's where she's experiencing pain at 45, so it'd be less than 45 degrees, with either a wand or a band or using her own hand to help guide that arm into 40 degrees of shoulder flexion. We will also be doing some external rotation, passive range of motion, and some pendulum swings. The patient will be ready to progress when the pain is gone or the range of motion improves, so where her pain is only at the end range. My second patient is a 72-year-old who presents 6 weeks post left distal radial fracture. The patient presents with 2 out of 10 pain at rest and increase out of 5 out of 10 pain with weight bearing through the left upper extremity and a wrist extension. She also has inflammation and pain. So one intervention that I would say would be appropriate at this phase would be to improve the range of motion since the cast has just come off of the left wrist. Things we could do would be passive range of motion, also active range of motion depending on pain tolerance. We would do some wrist flexion, wrist extension, and ulnar deviation and radial deviation. The way to tell if the passive range of motion and active range of motion exercises are being beneficial to the patient is to compare the baseline goniometric measurements done previously and seeing where the pain started and stopped during the first assessment, and then recording ranges post-treatment. Due to weight-bearing restrictions on the patient, since the patient does have a 5 out of 10 pain with weight-bearing activities, I would start with open chain exercises such as wrist flexion with a dumbbell in their hand or holding a band of some sort with resistance and wrist flexion and extension. Also ulnar deviation and radial deviation with some isometric holds with the therapist placing them into one direction or the other. Activity limitations the patient will most likely experience is going to be anything where they're opening a jar, where they could be cutting food, using any grip strength since their grip strength is lacking in this phase. If they're stirring, so anything where they're using any ulnar deviation, radial deviation, wrist flexion, or extension. Things like carrying items with their hands, or any, we want them to avoid any twisting of the fingers, like wringing out a rag with water in it. Participation restrictions that this patient may be experiencing is if this patient works from home and they need to type on their computer, this would be a participation restriction, as well as anything where they're carrying objects throughout their house. Okay, so I would instruct the patient to grab the wand with both hands if the affected side is this side. I'm going to have most of the work being done on the unaffected side, and we're going to raise them up to only 40 degrees before pain starts. And we're going to do this for 12 to 15 reps, just like so. And then the second exercise we're going to do is going to be external rotation. Next exercise I'm going to have the patient do is a active assisted range of motion into external rotation. So with the unaffected side, which is this side, I'm going to guide the other arm into external rotation. Again, we're going to do 12 to 15 reps, and we'll do 3 sets of this. Last exercise, we're going to be performing pendulum circles, so I will instruct the patient to use the unaffected side to hold their body weight over a table. Now with the injured arm, it's going to be fully relaxed and not moving. Now with the body, we're going to allow it to swing into circles to maintain the range of motion in that arm and let it move freely. Done.